Our next speakers will be presenting on pathology careers. So first off, we have Naomi Tolliver, who is the Senior Clinical Laboratory Specialist at Vitalant, which is our blood bank. Then we will hear from Shannon McPartland, the Senior Coroner Technician at the Sacramento County Coroner's Office. And finally, we will hear from Dr. Derek Marcy, a pathologist and the president of the Diagnostic Pathology Medical Group. Their session will conclude with a blood matching activity. Now, you received your blood type in the materials that we delivered to you earlier this week. Make sure you have those materials out for the activity that will be at the end of this session. Once again, there will be time for questions after all the panelists speak, and we will end, like I said, the session with an activity. Remember, raise your hand, your virtual hand, if you'd like to ask a question, or use the chat function. So Naomi, you are up first.
Okay, hi everybody, and thanks for being here. My name is Naomi Tolliver. I am, as she said, I work for Vitalant, which used to be called BloodSource. If you're from the area, you might recognize that name. My official license granted by the state is a clinical laboratory scientist, which is called a medical technologist in other states. I have a short video I wanted to show first that kind of, I don't know, it struck home with me for a lot of reasons. And so if you don't mind, we'll just watch it first. It's about 3 minutes long.
My name is Lucas Foster. I am 16 years old and I'm a blood recipient and donor. I was sitting in my fifth period science class that day. I'd gotten the call to go into the office, told me to bring my stuff. I was like, okay, this probably isn't a good thing. And so I get down there and I see my mom there and she looks pretty scared. We get in the car and she tells me they found a tumor in your CT scan results. And immediately I was mortified because I was like, what does this mean? Like, am I gonna live through this? Like, how am I gonna keep going after this happens? Like, how am I gonna get through this whole situation?
He was diagnosed with stage 3 brain cancer. He had emergency surgery, 4 rounds of chemo, 5 weeks of radiation. Throughout that process, there were many occasions where he had to receive transfusions of blood and platelets. I don't think a lot of people think about where is this going once it leaves my arm.
So I went through chemo and radiation and I had to get constant blood checks for my platelets, my white blood cells and all that stuff. And so platelets were a problem for me pretty constantly. For some reason, my blood just didn't want to cooperate. And so I got transfusions pretty frequently. I never really realized how much blood and transfusion stuff like that actually goes into the treatment of cancer. After I went through my treatment and got so much blood, I was like, okay, I have to find a way to be able to give back and do this so that I can pay it forward for all the people that did it for me as well. I'm glad that I'm able to help out whoever needs to receive my blood and that I'm able to do this to help save one or multiple people's lives if they needed it. Blood donation can do so much to help countless lives, whether it's a lot or a little that you donate. Like, kids and parents should definitely all try and get out and do it at some point in their life to see if they can change somebody's life and help them out.
For Lucas to be able to tell his story, that puts a face to something that most 16-year-old kids can't understand. But when it's the guy sitting next to them in class, it settles in a little bit more that someone like him needs this.
A lot of people don't realize how much cancer patients actually need blood to help them get through their treatment.
It takes an hour. An hour out of your day can save someone's life.
You don't have to be some kind of superhero to save a person's life.
Now we pay it forward.
It's a great experience to have too, to know that you might be helping somebody who's going through treatment or just needs the blood.
It's a very small thing that we can do to say thank you.
I would just like to tell the donors that donated the blood that I received, thank you so much. Their donations really helped me get through the whole thing with what I was going through.
It's not possible without another human being deciding that they're willing to help and willing to give.
you for showing that. So someone might wonder, well, why are you showing a big plug for blood donations? This is supposed to be about um, healthcare and pathology careers. And for me, when I saw that video, there were two things that stuck out. It's, you know, you can help your community when you're 16 just by donating blood or organizing a blood drive at your school. But the thing that really got me was I started thinking about, okay, from start to finish for that process, for this kid to not feel well, go to the doctor, get a diagnosis, get treatment, and then for a blood donor to come in, donate their blood, all of those things, how many different lab people had to be involved in that process? That's what got me kind of counting on my fingers. I'm like, okay, you have a doctor's office or a hospital, you have a trained phlebotomist doing correct patient identification and drawing the correct samples. The samples go to the lab, they diagnose this kid with, you know, this problem. And then during the chemotherapy, the maintenance, you know, he would probably be getting his blood drawn fairly regularly. And a lab technologist like me needs to show up at work on time and do their best work and provide the patient's doctor with the right information, accurate information for them to treat their patient. And then same thing, when a donor comes in and wants to donate blood, there's usually a nurse in the donor centers and trained staff who evaluate the donor's health and whether or not it would be safe for them to donate. And then their blood goes to another lab and gets tested for infectious diseases and blood counts to make sure it's safe for a patient like Lucas to receive their blood. And so I'm thinking about all the different people who are hands-on in that process, and it kind of blows me away. And so blood banking, you know, I'm partial to it. I was a veterinary technician for a long time, and we actually did blood transfusions in dogs and cats. And I got really into the diagnostic part of that and providing the veterinarian with the best information that I can provide for them to make decisions, similar in human healthcare. And when I moved to Sacramento, I discovered that being a veterinary technician was not going to be a living wage. And I really had an interest in the sciences. I loved medicine. I loved anatomy and physiology, but I didn't really want to go down the route of doctor, nurse, or veterinarian. And so I found this career path, clinical laboratory sciences, and it suits me perfectly. And the reason I was interested in talking to students is because I wish I had found this sooner. It is, I believe, one of the best careers one can have with a bachelor's degree and some external additional training. I think it's incredible. There's a lot of different reasons why someone might want to explore this career. For me, I was a math and science geek in high school, but that was a long time ago. And that was before the internet where you could learn about different career paths. And I said I didn't want to be a teacher, so I didn't go to college right away. I don't recommend that. Even if you don't really know what you want to do, start something. And so the reason I'm interested in kind of championing the clinical laboratory sciences is because the more I learn, the more I realize there really is something for everyone. No matter what your personality type or your skill set or what interests you, whether you just want to get through school as quickly as possible and make decent money, you can do that. You can have a clinical laboratory science license and work for industry. You can work for the companies that provide the things that we use on a daily basis to do our jobs. Those companies hire people to come into labs like mine and help us learn how to use things. Hospital labs are, of course, the primary focus for clinical lab training programs. They need people. There's a lot of people retiring and not a lot of new blood coming in. So in a hospital lab, you would work either in one department or multiple departments. Kind of depends on the size of the hospital. There's lots of different things you can do. For me, I like blood banking, but there's people that work in chemistry, microbiology, where they grow things, which I think is gross. Chemistry, there's so many different avenues. And then if you're really technology driven, there's everything runs on computer science now. So there's a whole subset of people that work in hospitals and other places like where I work, and they just install and maintain the computer systems that manage all of the patient information. So I just feel like the more I learn about the options, the more amazed I am. So I would say if you have any interest at all in science, technology, medicine, but you're just not sure where to go, get your hands into some classes. Like at Folsom Lake College has a great program for pre-lab sciences. You can kind of get your hands into different things and see what you feel comfortable with. I could talk about it for hours, but I've only got a few minutes.
So Naomi, you have a couple questions here.
I'm happy to answer them.
So one of them is, what was the subject that was hardest for you to study?
Okay. So for the clinical lab science degree in California, one has to finish a bachelor's in science with a specific concentration, is what they call it. So you take electives. Honestly, the science courses are easier for me because I'm interested in it. The hardest stuff for me to get through are the things that one has to take to graduate, like the social sciences and humanities. I struggle with those because I like numbers and data and things. I'm not very good with the humanities. I did have kind of a struggle with organic chemistry. It sounds like a scary course. It can be if you have kind of a lousy teacher, but I teamed up with people in my class and we studied together, and everybody's different, like the way their brains work. Everybody could help each other. So I would recommend, if you find something that you find difficult, get together with your peers and bang your heads against it together. So yeah, I guess for me, the humanities, I hate to say it, but it's true.
All right, one more question. How old do you have to be in California to give blood?
You can give blood when you're 16, as long as you have parental permission, and if there's a compelling reason. 17, I believe you can walk into a donation center and give blood.
Okay.
Vitalant
Right.
also.
We have a blood drive next month. So Sam, would you mind putting the blood drive information in the chat if any of the students are interested in signing up?
I also have information if anyone's interested about who they would contact to set up a blood drive at school. So that would be maybe something you could do for extra credit, or it would really look good on a college application.
Absolutely. So if that's something that you sent to Sam, she'll send it out as a follow-up email to all the students today.
I will retrieve the information from my work email and send it hopefully today, maybe tomorrow. We're looking at opening back up for tours now that some restrictions are changing. So again, if any students were interested in tours, we could probably set something up.
So we have another question. If you're 15 and have parental consent, can you give blood or no?
I don't believe so, but there could be a compelling reason, like if you were donating stem cells or something for a sibling, that would be a doctor's decision, but not as a routine walk in and give blood. At 15, you're still developing certain things, and the process of donation isn't completely benign. So they do want to make sure everything's safe for the donors as well. But in very, very, very specific situations, you probably could.
Great. Okay, well, thank you so much, Naomi. Students, help me tell Naomi thank you. And if you have any other questions for her, just put them in the chat and we'll try to get to some of the questions at the end. So next up, we have Shannon McPartland. I keep wanting to say McPark, but McPartland, with the Sacramento County Coroner's Office. So this, honestly, you guys, I've been waiting to hear from Shannon because I have a lot of questions. So Shannon, please take it away.
All right. Hi, I am Shannon McPartland, and I am the Senior Coroner Technician with the Sacramento County Coroner's Office. So what I like to kind of do in the beginning is explain what a coroner's office is and what we do. So our goal is to provide cause and manner of death for people who pass away in Sacramento County. It is for unwitnessed or violent deaths. So it's not everybody that dies in the county. So if say somebody has cancer and they have a doctor and they've been seeing them for a long time, that doctor can sign a death certificate with the cause and the manner, and they don't ever have to come here. But if there's something that they haven't seen a doctor in a really long time, or there's no real reason why somebody should be passing away, we will get the person in our office and we'll perform an autopsy to determine why they died. And, you know, just kind of what I like to consider it is, you know, providing closure to families. So my general day looks similar most days, but the really cool thing that I find is that no matter what is happening, the things that I get to do are always different. So not every autopsy is different. You know, every interaction that we have outside of the office is different. So we start off generally during the day by performing autopsies with the pathologist. So our coroner technicians are the ones that are helping to take out the organs, take the samples for toxicology specimens. We also do take evidence that will be turned over to other investigating agencies like the police departments or the sheriff's office. And we you know, help the pathologist with whichever, you know, whatever they need. We also do respond to scene calls and hospital calls. So I go out and pick up people. If it's a car accident on the freeway, I will be there removing that person from the car, or at a hospital if they pass away and there's a question as to why, we'll go there and pick up. The other thing that is a really big, really important part of our job is that we release the decedents to funeral homes. So we interact with the funeral homes, make sure that all of the paperwork and everything is taken care of, and that the families, you know, are able to get their loved one and have, you know, some kind of service if that's what they're interested in. So for my schooling, I actually have a bachelor's in microbiology and a master's in forensic science. To start though, for anybody who's coming on as a, you know, entry-level coroner technician, we really just require them to have 30 college units of in the sciences, or like criminal justice. So a lot of people are either studying, you know, pre-med. We get a lot of pre-med people coming through. We also have an internship program, so I get pre-med people applying to that, or criminal justice majors who want to study forensics and want to work in the field of forensics. So we kind of mesh together the medicine side as well as the forensics and the law enforcement side. So with that, you know, I'm always asked what are some of the more interesting cases that I've worked on. I have been here for quite a while. So back in 2000, we got duffel bags out of the Delta, which turned out to be human remains, and they were cut into pieces, and it was 3 different people. So part of what we had to do was first to get everybody identified, because you want to be able to inform their family as soon as possible that you know what has happened to them. But we also want to figure out how they died, and in the end collect enough evidence to possibly prosecute those responsible. So you know, I remember working with the pathologist and, you know, doing everything from he would determine which direction the garbage bag inside the duffel bag was turned to determine how it was tied up so that, you know, if you got a person that they're arresting and he's right-handed, but the doctor determined that the person who tied this bag was left-handed, well, then you have to figure out why there's a difference. You know, we collected things like fingernail scrapings like you see on, you know, the TV shows, you know, if there's DNA under the fingernails. You know, we collected a lot of that. And I remember a lot of that evidence ended up going and being used in court to prosecute the two people, I think they ended up being brothers of the murders. So, you know, I feel like yes, this is a job, and yes, you know, I come here for a paycheck, but I also feel like it's really important that what we do here is, you know, not only is it providing the closure for the families, but it's also helping a little bit in the law enforcement side and making sure that there's good science behind the evidence that's going to court, and helping to prosecute or determine that somebody is innocent of a crime. So we cover the medical legal aspect is what we do. And like I said, it doesn't take a whole lot of schooling to get in where we're at. It's just about whether or not, you know, like I love medicine and I love forensics. And so this seemed like a perfect match for what I love to do and what I enjoy doing. And it's always something different every day. So to me, that's exciting. And I think that's pretty much.
Couple questions for you, Shannon. So I knew we were going to get this one. So has a dead person ever frightened you, and what did you do to maybe get over some of those feelings that you might have had?
I don't know if I've ever been like frightened of something. I have had where I roll a decedent, you know, so that the doctor can look at the back, or, you know, we're doing something and they have made a noise because the air has escaped past the vocal cords, and that has startled me for sure. And it's always just remembering that it's just, you know, the air escaping. It's not, they are not coming back to life, I promise. I have never had anybody sit up on the table. It's never anything like that. You know, but one of the things that I have had sometimes affect me is going out to a scene and being with the family members and the loved ones and watching them grieve. And that sometimes is hard, you know, because we've all had experiences in our lives, you know, where we can empathize. And so, you know, I have to remember that I'm there in a professional capacity, and as much as I feel for them, you know, it is my job to remove their loved one with the most care and you know, compassion that I can. So.
All right, another question for you. Don't know how in detail you want to go, but how does the autopsy actually work? Like what is the normal process?
All right, so the normal process starts with our, we take a lot of pictures, you know, so the external, you want to take pictures, you want to document any kind of trauma or anything that is seen on the outside, and then we kind of work our way inside. So after the external portion is done and, you know, you determine that there's not like a knife sticking out of somebody's back, because that would be bad. You know, we do what's called a Y incision. So you start at the shoulders and you come down to a point in the chest and then open down. So it opens up so that we can see the organs, you know, and then we remove, there's a couple of different ways you can remove organs. You can remove them in block or individually. It just depends on what the pathologist prefers. One of the other things that we also do as coroner technicians is we open up the head, the skull, and remove the brain. So, you know, it's about making the incision and removing the skin, the scalp, and then taking a bone saw and sawing around so that we can remove the brain so that the doctor can make sure that there's no trauma, there's no bleeding, there's, everything looks good. So once we're done with that, like I said, we collect all the evidence and all of the specimens. So we get a lot of blood samples. We collect the vitreous fluid from the eyes. We collect urine samples, anything that if we need to test for different types of drugs, or like if somebody's diabetic, we can look for the sugar levels or the electrolyte levels. So that there's a lot that we can test for. So we do that. And then to finish, we then sew up the decedent. We put all of the organs that we didn't, so we take small pieces of each organ so that if we need to look at them under the microscope, we can, but everything gets returned to the decedent in a bag, and then we sew everything up, clean up the decedent, and then make sure that, everything is clean and in a bag for when it goes to the funeral home.
Okay. So what happens if you don't figure out what happened to a person, and how often does that happen?
So it does happen. There are times when it just is really hard to tell if there's no obvious natural causes, if their blood work comes back and they haven't taken a huge amount of some kind of, illicit substance or prescription medication. There are different types. So the manners of death are a natural, accident, suicide, homicide, but we do have undetermined, and undetermined is something that you can label. It's harder because it doesn't give families like the answers that they really need, but sometimes it just happens. And it's also, so if somebody has an extremely high level of a certain kind of drug or medication, did they take all of that on accident, or did they mean to? And at this point they've passed away and we can't ask them. So sometimes they become undetermined because we don't know the state of mind of somebody. But I've also seen where it's just hard to tell, and it will end up becoming undetermined. And you try very hard to figure it out, but if you run all the tests and everything comes back negative or normal, the only way to do it is to call it undetermined.
All right, and then just one last question. I actually commented that we have a staff member in the office, Sam, who runs all of this for us. She actually interned at the coroner's office and really enjoyed her experience. Are there opportunities for internships? How old do you have to be, and where can the students go?
Okay, yeah, so our internship program is generally for college age students who are studying sciences or criminal justice. You definitely have to be over 18, but we offer, it's a full year where you come in 1 day a week for that year, and you do pretty much all the stuff that we do autopsy wise. Our interns are really hands-on. We show them everything. We really want to make sure that they get, a good understanding of the human body and what we're looking at, and, the different ways that the human body can kind of malfunction in a way. And so I am the coordinator for the internship program at Sacramento County. It's just starting to get rolling again after COVID. So I'm just now starting to go through applications again, but I do have an application, and usually I have people email me so I can provide that. We can provide my email address and all that stuff for anybody that's interested.
Great. So you may be hearing from quite a few people on this Zoom call in a couple of years. Not yet. So wait until totally you're in college, kids. Well, thank you again, Shannon. This was absolutely wonderful, and I just a really interesting career path. So students, if you have any other questions for Shannon, please put them in the chat function, and we'll either ask them at the end of this session or we'll email them to Shannon, and maybe she can answer them then. Okay, so next up, we have Dr. Derek Marcy, who is a pathologist. So Dr. Marcy, please take it away. I believe you have a PowerPoint to share with everyone. We can't hear you if you're talking.
Now can you hear
There
me?
you are.
All right.
Yes, we can.
And see my PowerPoint? Good. All right. So my name's
Yes,
Derek
we
Marcy.
can.
Thank you. Shannon, you're a tough act to follow, I have to say after that, but I'll do my best. I'll say when I did we have to do autopsies as part of pathology training, and I almost fainted during my first autopsy because if you're not prepared for it, it's really something to behold the first time you see it. You get used to it, but it's certainly not what I expected. So I am a pathologist, and just a little bit about my background. A pathologist is a physician, so you have to go through 4 years of college. I went to Marquette University in Milwaukee, Wisconsin. I then went to medical school at Ohio State University, and then did my residency in Boston and my fellowship there as well. And it took me 5 years total for my residency and fellowship. So it is a long haul to get there, but I think that's true for most fields, most physicians. So what is a pathologist, right? We talk about a pathologist, and I'd like to spend a little bit of time about this. Everyone, I think, knows a cardiologist. Cardio means heart. Neurologist means the nervous system. What is a pathologist? So as a pathologist is a specialist in the disease process, right? And so pathos, this doesn't sound great, but this is what it is a Greek word that means a quality that evokes pity or sadness, suffering. So this is what a pathologist does. We are a physician who studies laboratory fluids and tissues, using tests in the microscope to help your doctor make a diagnosis about your health. So pathologists are often called the doctor's doctor, right? Because most people don't know what a pathologist is, to be honest, unless you've had a family member who's had a cancer diagnosis and you've heard about a pathology report, unfortunately. Most patients will never encounter pathology most of the time. We interact with other physicians to help them make a diagnosis. We've already touched on many of these areas, these different areas of pathology. We heard from Naomi talking about clinical pathology, right? What I do is anatomic pathology, which is broken broadly into surgical pathology and cytopathology. Shannon gave a great overview of forensic pathology, and then there's also experimental pathology who do it in the research setting. And this is just, I think Naomi did a great job explaining about, these are some of the clinical laboratory scientists, and pathologists are responsible for supervising and directing the laboratories, but the labs are run by these highly trained, highly skilled scientists who run the machines, so that when you get your blood sample taken and it says that your sugar is 90, how do you know that it's really 90? How do you know that it's not 150 or 30? How do you know the machine is right? And so these people are responsible for making sure that the machine is run properly, that the values you get you can trust, right? And so the pathologists are responsible for directing and supervising all of these highly skilled individuals. Also, the blood bank is a very important aspect, as Naomi mentioned, maintaining the blood supply, keeping the safety of the blood supply. So when you go in and you need blood urgently or unexpectedly, that they have the right type of blood for you, and that make sure that they go through the right process to make sure that it's safe for you. So this is what I do. This is my what I spend almost all my day looking into a microscope, looking at slides to make diagnoses. And this is the area called surgical pathology. And so I don't know if I can see anything. Does anybody know what this is? I don't know if I can see your responses or not since I'm sharing my screen, but so this is a kidney here. And you can see this kind of reddish part off to the side. This is normal kidney. And this large yellow orange area is a tumor, right? That's a kidney tumor that should not normally be there. It's a very large tumor, as you can see. So the question is, how does this kidney and this kidney tumor, how does it get turned into a slide? This thing is about at least as big as your fist, right? How do we turn it into a slide that I can look at under a microscope and make a diagnosis on it? And so there's a process. This is a long process. It takes overnight. So, and it takes multiple steps, and there's multiple skilled, trained individuals who work not in the clinical laboratory, but in the pathology laboratory, doing this, processing the tissue. They first have to take this tissue and cut it up into pieces so it'll fit into these things that are called cassettes. And they have little holes in them so that fluid can pass in and out of them. You put them into this machine here, which will dehydrate the tissue. So it goes through different stages of chemicals. It starts off with mostly water, and then one with a little bit more alcohol in it, less water, and then more alcohol and less water till you get all the way with no water in them. And eventually to solutions like xylene, which are organic chemicals. So you remove all the water from the tissue. Somebody then has to embed the tissue, which means how you orient it if you're going to cut it for a slide. So if you think about something like a banana, for example, if you cut a banana across it, right, into slices, you'll see that cross section of the banana. You can cut it all the way down the banana, and it has a certain look to it. If you cut it long ways, it will look completely different, right? Because it's a different way of cutting it. So when we put the tissue in here, we have to orient it in the correct way so the pathologist can see what they need to see. And then what they do is they embed it in wax. This is all wax, like candle wax. It's here, and you can see this yellow, if you can see that. That's the tissue in the center of the candle wax. And then another very skilled technician will take those and cut very, very thin slices on this machine called a microtome. Each of these slices is about 5 microns thick, which is about the thickness of a single cell, right? That's how every time they turn this crank, the machine moves forward just a tiny bit. And they have to create these very thin sections and flat sections so that I can look at them under the microscope. Again, so lots of positions here in the laboratory that are involved in this, processing this tissue and making a slide before I ever even get to look at it. This whole process takes overnight, typically. So we go back to our kidney here. And what would happen would be another skilled technician called a pathologist assistant, or a PA, will take a section out of it right here. They'll just cut a little piece out of it, and they'll put it through that processing that I showed you just a moment ago. And then we look at it under the microscope, and it might look like this, right? Depending on how much biology you've had, you'll recognize these blue circles. These are the nuclei all scattered through here. This is a nucleus. This is a nucleus. All of these are nuclei where the DNA is stored, right? The genetic material of the cell. And you can see these thin pink lines, if you can see those. These are the edges of the cells where the cell border is. So this separates this cell from this cell here. You can see the blood vessels running through here, right? And you can see the cytoplasm, which is kind of where the machinery of the cell is this cleared area here. This is very typical for cancer of the kidney, renal cell carcinoma. And so in surgical pathology, what you have these tissues and everything is locked in place. It's like taking a jigsaw puzzle that's super glued, right? This cell is fixed in position next to this one. It's fixed in position next to this one. So they can cut through this tissue as a single thing, and you can keep seeing these cells as they are related to each other. So that's what surgical pathology is. The other area is called cytology. Cytology doesn't deal with pieces of tissue. It deals with fluid and cells in fluids. So what you see here on the right, these are individual cells, very large cells. Again, the nucleus is this dark blue, and here the cytoplasm is kind of this blue-greenish. And you can see here's a cell that's kind of floating all by itself. Here's another one floating by itself. Here's a kind of a cluster of them, and another one floating by itself. So what you do in cytology, you take a drop of fluid with cells in it, you put it on a slide, and you smear them all out. So these cells all get separated out. You can see them very clearly. You don't see them super glued to each other. You don't see them in relationship to each other, but you can see them, how they look very, very closely and very carefully. And these are cancer cells here. Again, you can see because the nucleus has multiple parts to it. They're enlarged. These are malignant cells, unfortunately. So the two areas I specialize in, one of them is hematopathology, which is blood disorders. So I look at bone marrows and lymph nodes, looking for leukemia and lymphoma. This is a bone marrow biopsy here. You can see this pink, thick area. These are the areas of bone in the bone marrow. And this is the actual bone marrow itself, where all the cells in your blood come from. Your red blood cells, your white blood cells, your platelets, they all come from here. This is a tissue section that's cut, like surgical pathology I described earlier, but it's also actually liquid. So you can suck those cells out and spray them out here in the bottom corner, and all these cells get separated individually, and you can see them and have to count them and categorize them. See if they look atypical, see if they look like cancer. We have cells here that are red blood cell precursors. We have these cells, which are the cells that are going to fight infection, the myeloid cells. We have this huge cell over here, which is a megakaryocyte that's going to produce platelets. The other area I specialize in is dermatopathology or skin pathology. And here you have a mole on a woman's face. It's raised. It's got some pigmentation to it, a little bit of darker color. And when we look at it under the microscope, this pink layer here, this band that kind of goes up here and curves, this is called the epidermis. This is the outer layer of the skin. So you're looking, it's like you cut down into your skin. This white up here is the air that overlies your skin. And now you're heading down into the tissue towards the bone, kind of. So you have the air there. This pink is the epidermis. These cells are the cells underneath, and you can see they're kind of darkly pigmented. These are the melanocytes that give this thing its look of the dark pigmentation. And these are benign. This is just a normal nevus. So I do spend a lot of time scanning through these. I'm basically a cancer scanner. I scan bone marrow biopsies looking for leukemia. I scan skin biopsies looking for melanoma and for other types of skin cancers. So here's another example. This is a patient who comes in. This is a chest X-ray. You can see here are your ribs across here. Here's the heart on the left side. So you're looking straight on at the patient. Here's your diaphragm here that separates from the abdomen. And if you notice up here in the box, there's a nodule there. That shouldn't be there. And the question is, what is this nodule? How do we know what it is? Is it cancer? Is it a benign growth? Is it infection? The only way we can really find out is by taking a sample of it, a tissue sample, and giving it to the pathologist to make the diagnosis. And in this case, it turned out to be infectious disease, right? You can see again, here's the lung spaces, here's the infectious focus, and we have special stains we can put on these. This is a stain looking for fungus. So these are fungal forms that might be growing in there. This is a special stain looking for mycobacteria, which is tuberculosis, which could be growing in there. So we can look at this, we can tell them, yes, this is good news, it's infection, it's not a cancer. And we can even help them figure out what kind of infection it is that they're dealing with. The final thing we do is called frozen sections. This is to help surgeons in the operating room. The most important thing for a surgeon to know when they're taking out cancer is, did I get all of the cancer? Because they don't want to leave any of the cancer in the patient if they can get rid of all of it. Now, the tissue processing process I showed you earlier takes overnight. You can't wait that long, right? While a patient is asleep in the operating room, they're open, and you need an answer within 30 minutes. So instead of going through that long process, what we do is we freeze the tissue in a microtome here at -13°F. We snap freeze it, we section it, and we stain it. What we're looking for is, here's an example. The surgeon took out this tissue, and this pink is the normal tissue, and in the middle there's a tumor, right? And it looks like here's the edge of the tumor. The surgeon got all the way around that tumor. We can tell that the surgeon, good news, it looks like you got all the tumor because the edges do not have tumor in them. In this one, unfortunately, you can see the tumor extends out to the edge. So if I section this area here where the tumor goes to the edge and I look at it, there will be tumor there, which means that the tumor probably continues on into the patient as well, because it's at the edge of the tissue that they took out of the patient. So we can tell the surgeon whether they got all the tumor or not, or whether they need to keep going and still take more. So I like to say, I wish I could say that a pathologist is the most important physician that you'll ever meet. But unfortunately, it's probably more accurate to say that they're the most important physician that you'll never meet, right? And I like to kind of make the analogy of a pathologist like the Wizard of Oz, right? He's the guy or the gal behind the curtain, right? Pay no attention to the guy behind the curtain, right? He's there behind the scenes doing important things, but most people don't know that it's going on. So a couple things that are very important to being a pathologist. Of course, you have to be very detail oriented because you're looking at microscope slides. You can't miss things, right? Because if I miss something and I miss a cancer cell, that could have obviously serious implications for a patient. But you also have to be able to communicate very clearly, because everything I do is issued in the form of a report. I issue a report to the surgeon that tells what the diagnosis is and what the prognosis is. That is yes, it's this kind of tumor, that's the diagnosis, and some prognostic features. This one looks bad. It has these features that are worrisome, or it has these features that are not so worrisome, right? So you have to issue a written report that has to be accurate. You have to be careful of typographical errors and spelling. These are all very important, right? Last thing I'll say, because there's another area of pathology that has a lot of career opportunities, I think, is what defines a disease? This is kind of a very broad question, right? Is it by the symptoms the patient has? If you have a migraine, for example, it's defined by the symptoms. Is it defined by this disease process in the microscope, like the cancer of the kidney I showed you, right? That's defined by the fact that we see it under the microscope, we give it the diagnosis. There's another area too, that genetic changes, right, that can do it. So here we see, these are all chromosomes, right? We all have 46 chromosomes, 23 pairs. And so we can do different techniques to identify abnormalities, right? And this is a normal, what's called karyotype. And you can paint different areas on the chromosome. So for example, here on chromosome 9, each of them has an area that's colored in red, whereas in 22, each of them has an area colored in green. So when you look at it under a special microscope, you see 2 red and 2 green, because you've got 2 copies of each, right? But in certain diseases, you can see only 1 red and 1 green and a yellow, where the red and the green have come together, right? And why is that? That's because one piece of this chromosome has broken off and been fused to the other one. So you have a chromosomal abnormality, a translocation in the chromosomes, right? And so there is a lot of positions actually where people look at these kind of genetic changes in the laboratory as well, and make those diagnoses that are not pathologists, but are very, again, highly skilled and trained scientists. And just, to let you know, this is a field that's going to be continuing to expand, right? If you look at this, the cost to sequence the human genome, right? The first time it was done, it cost $100 million. $100 million to sequence one genome. And now it's down to below $10,000 if you want to sequence a human genome, right? So we're getting tons and tons of information from the human genome, right? And genetic information, and we don't know what to do with it, right? Much of it, we have all this information and no idea what to do with it, what's important, what's junk, what we don't need. And so being in an information technology career is also, I think, a great career in medicine, right? Because all this information that we need people to help us sort through. And in pathology, we have all these tissue blocks for all these diseases going back 10 years. If we ever need to go back and do studies later for things that are discovered, we can always go back and do that. Thank you very much. That's my presentation.
Lindsay's just having one little issue with her audio, so give us a second here.
This has been excellent. This is Dr. Eric Williams. Really appreciated it. I wonder if the students have any questions.
Looks like there's a couple of questions here. You can't see me, but I'm here. So what was the most rewarding aspect of becoming a pathologist, Dr. Varsi?
So I'm an analytical person, right? I like being able to sit down and make a diagnosis. There's something very rewarding about doing that, right? I like knowing that I think it's more my personality. I like kind of solving that and dealing with the problem. I also like the fact that pathology is different in the sense that you have a little bit more free time in medicine, right? I don't have patients kind of stacked up with appointments. I have slides that come in and biopsies that come in, and I can read them now, or I could read them in an hour, or I could read them in 30 minutes. I can schedule my day a little bit more flexibly, right? And so that's been very rewarding. But I like knowing that I contribute kind of behind the scenes, and I don't know, I just find that very rewarding, right? It is an extremely important role. And I like kind of being in the shadows and doing it, I guess.
All right, looks like you had a bunch of thank yous for your presentation. So students, if you have any other questions for Dr. Marcy, just email Sam or me and we'll get them over to him to answer. So now we're going to do a quick activity. Our breakout rooms are not working. As you can see, my camera isn't working either. So we're going to do this in a large group instead, and Naomi is going to lead us through this. This is a blood matching activity. So get the cards out that you received in the mail to see what type of blood type you are. And Sam, will you go ahead and share the slides, please? Okay, so humor me, please. If you're in blood group A, raise your virtual hand, if there are any. Oh, we got some. All right. So Naomi, will you share with us more about blood group A and who they can donate to?
She's muted.
You're on mute, Naomi.
Do we have this slide that shows kind of one type of testing? So I'm just going to babble on because I love blood banking. So the slide that you saw says, okay, a blood group A. Oh, there it is. So one way of testing to see what blood group you are is to take what's called antisera. And it's something that is produced in your body, antibodies to something you don't have, basically. So you're pre-programmed to make these antibodies. We've heard a lot about antibodies from the COVID vaccine. And so it's a protective mechanism that the body makes. They go and they find things that don't belong there. And so if we put anti-A and anti-B, those drops there, what those will do is cause, if I put red cells that are group A into each little area there, the antibodies to A will cause the cells to clump. So you can imagine if it's happening in your body, that probably wouldn't be a good thing. But what that does is show you that that person's blood is group A, whereas in the anti-B, there's no target, so it just stays liquid blood. So if you're group A, and I'm group A, you have an antigen present on your cells, and an antigen is like a structure on the cell membrane. Some of them have purposes and some we don't know yet what they do, but it defines you as a group A. It's a specific type of entity. So for me, I'm group A. I'm pre-programmed to make antibodies to group B because that would be foreign for me. So if I look at the potential who can donate for me and who can I donate to, I would be able to accept blood, red blood cells from someone that's like me, so group A. I would not be able to accept red blood cells from a group B person because their structures on their cells, my body would reject those as foreign. There's also a group O, which you may have heard called the universal donor. They lack either structure on their red cells, so they're considered a universal donor because whatever blood group you are, there's nothing on those red cells for your body to react to. Okay, so if you were assigned a blood group, I think we did them like in percentages, like in an average population, there's a percentage of 45% is group O, approximately 40% group A. So some of you are assigned to be group A or AB.
Many of them are saying they're group O right now. I had just asked that in the chat. So
okay,
yes, many students.
so who can you donate your red blood cells to?
Put it in the chat or raise your hand and say it.
No, just think about it. Like, okay, who can I can donate to anybody.
They're saying anyone.
Yes.
Yes.
You can donate red cells to anyone. And so on the opposite side, the fluid part of your blood, not the cells, you have antibodies in the fluid part of your blood, just naturally. And that's your plasma. And so if I'm a group A and I have anti-B in my blood, would I want to donate plasma to a group A person or a group B person or a group O person? Who could take my plasma or the liquid part of my blood?
Looks like we're guessing everyone again.
So I'm group A. So if I look at the red blood cell, it says patient types your blood can help, right? So I'm group A, so I'm going to go down here, say pretty much anybody. It's a little more complicated when you start to get into that stuff. And Dr. Marcy, if you want to jump in, please help me out. But we can donate red cells. We can donate platelets, we can donate plasma, but we'll focus on the red cells. If you are a group AB, what red cell types can you have given to you as a recipient?
Was there anybody that was in the group AB? Was anybody assigned it?
There should be 4 to 6 group ABs. Okay.
I think AB can only go to AB, right?
Correct, because you have both A and B structures on your cells. So anyone who has an antibody in their blood to A or B antigen could have a reaction to your blood. So a group AB person can donate red cells to a group AB person. And who else can get blood? Okay, so if you're a recipient, let's say you're a patient and you're group AB, you can you receive red blood cells from a group B donor?
All right, thanks, Naomi. That was, wow. I wonder what, I actually don't know my blood type. I probably should go try to figure out what it is. If you give blood, they tell you immediately, right?
What's that?
If you give blood, they will tell you your blood type?
Not right on the spot, I don't think, but once your red blood cells go to the lab and get tested for your blood type, as amongst other things, yes, you will be informed as to your blood type. I didn't know mine until I donated blood. So.
All right, well, students, please join me in thanking Naomi, Shannon, and Dr. Marcy for their wonderful presentations. Pathology sounds like a fascinating career, and